Hey everyone, good day to all. Myself, Dr. Ajay Moria. Today, we already started the series of 150 plus topic discussion. Short for the Fmge. This is going to be part 4, guys. For the PDF, the link in the description, or else you can just type the search. Just you can search Fmge aspirant Dr. Ajay Moria in the Telegram. Okay, get the PDF. Okay, so guys, without any wasting time, let's move on to the topic. The first one is, guys, about the copper metabolism, defects of the copper metabolism. Is the Wilson's and the Menkes disease. Wilson's and the Menkes disease. Okay, I'm going to explain you guys in the exam point of view. Okay, Nara. So the first one is the, guys. Remember what this first one is the Menkes disease. This first one is the Menkes disease. Second is the Wilson's. Second is the Wilson's disease. Okay, see here, MD, what am see, means see, M will come first, na? In the alphabetic orders, M will come first. That's why we are starting the Menkes first. See, MD, the MD means what? Doctor of Medicine, MD, the water Menkes, it is copper deficiency. Obviously, see, Wilson will be E sound, excess, okay, na? As it is copper excess. Okay, here the gene is ATP7A. See, the in alphabetical order, M will come first. So that's why it is A. ATP7A, and Wilson is the ATP7B. Okay, see here, actually what happens here in the Menkes disease, there is going to be the deficiency of copper because of where in the intestine, across the intestine they're going to be deficiency of copper because due to the absence of what defect in the lacyl oxidase enzyme. So guys, if there is no absorption of the copper, then there is going to be there is going to be loss of the developmental milestones, failure to thrive, epilepsy, hepatitis, and liver failure. And we'll see this this is the kinky fragile spaces beaded hair. Okay, so that's why you have to give the water. If there is a deficiency in the copper, then you have to give the copper chloride to get the L-histidine injection. Coming to here, this is the Wilson disease. Here what happens here is the Wilson is the excess, is going to see copper is not going to excrete it from the liver here. That's why in the liver the copper is going to what excess. That's why it is going to be the toxicity to the liver. That's why see this. That's why from the liver is going to spread throughout the circulation. Okay, in the eye it forms the Kesar flexure ring. Okay, and it also called as the sunflower cataract. Okay, sunflower cataract also in the Wilson's disease, and here, and there is a care, and also sunflower cataract where this is the copper is deposited in the basement membrane of the cornea. Okay, na? There is a C in the both cases, there is a low ceruloplasmin. Okay, so if there is a more toxic copper is going to toxicity, there is going to be obviously there is going to be the water mark, there is going to be the liver fibrosis also. Okay, there is a degeneration, hepatical endocrine degeneration. Okay, done. You have to give the treatment. Next one, coming to this is the from the protein. Okay, from the Kwashiorkor and the Marasmus. Next is the Kwashiorkor and the Marasmus. This is the nutrition deficiency. Okay, see here. First one is the Marasmus. Marasmus, see Mako. See Marasmus what? Mar gaya. Mar means what? About to die. It means what? He will be very thin. See here, the child is very thin here. See, Marco, see, Marasmus, Marco, and means what? Co means calorie. It is the calorie deficiency. Kwashiorkor water mark, KP, it is what is a protein deficiency. Protein deficiency. Okay, na? Remember, what is the highlighting point in the Kwashiorkor and the Marasmus is the C here. W for water, W for water. W for water. Remember that Kwashiorkor is a washing worker. So, how you are going to wash with the water only? So W for water. Water means water. There is going to be edema. That's why see the edema is the is the highlighting points here. There is a edema in the Kwashiorkor. In the marasmus, there is no edema. Okay, obviously when see here, it is a edema here. That's why he will very something. He will is a fatty here. That's why guys there is a less appetite. There is a less appetite, so poor appetite. But this guy will eat more. Okay, there is a voracious eating. Okay, the see. Okay, now they are the very important. You have to remember from the Kwashiorkor and the marasmus. And also you can see the in the skin that there is a flaky pain, dermatitis, and you can see the hair is a watermark is a flax, and the flag sign is a salt and pepper hair, flaxen. From here you can see there is a old man appearance, boggy pant appearance. Okay, now remember these are the main important difference between the Kwashiorkor and the marasmus. Okay. Next one, Sira. Next one, Sira. From the diabetes, guys, I already discussed about the diabetes drugs. Diabetes drugs. Okay, now we are going to learn about the diabetes. Diabetes normal values here. Okay, now see how they are going to test you in the exam, guys. First of all, let me know. Let me explain this one. Okay, see, this is the question they're going to ask you. Which is the best for which test is best for the long-term sugar control? Long-term sugar control, it is the water, this is the HbA1c. HbA1c for the long-term sugar control up to it will says about the 3 months. Okay, 3 months sugar control, 3 months up to 3 months now. Okay, now so suppose example if you want to know the current sugar, if you want to know the current sugar levels, then you have to go for the FBA, that is the fasting blood sugar. If you want to know the current blood sugar, then you have to check the sugar control. Then you have to go for the fasting blood sugar. Okay, now and also for the guys for the random blood sugar, guys. First of all, you have to do the GT, that is what means glucose tolerance. This is glucose tolerance test. You have to give the 75 grams of glucose first to the patient. Then after 2 hours, you have to do the RBS. Okay, remember here from the HbA1c, what is the normal value? It is the 5.6. It is the 5.6. C is the 5.6. Just reverse this. What happens? 6.5. It means 5.6 panja chakka. Panja chakka is what amma? It is normal. Chakka panja it is diabetic. See, 5.6 is normal. Reverse 6.5 is a diabetic. Between these values, it is a pre-diabetic. It means good control. This is diabetic. Like this also, remember these values also. Okay, FBS normal is less than 100. Pre-diabetic is the what 100 to 125. Diabetic 126. This is how they are going to test you in the examination, guys. Okay, they'll just give these values and you have to interpret. Remember here now for the DKA. Okay, for the DKA, see these are the complications of what they are the complications of diabetes mellitus. See, DKA mostly it is an emergency cases seen in mainly diabetes 1 and in the uncontrolled diabetes 2. Uncontrolled diabetes 2. Okay, it is triggered by infection and the stress. What the chief complaint? Patient is dehydrated and having the nausea, vomiting, and the polyuria. They just shock, BP will be low, and the increase in the heart rate. Okay, see, patient can be in delirium and acute confusion and confusion state and are in the coma. Okay, there is going to be the metabolic extrosis. I think everyone knows about this. And the patient having the rapid breathing, that is called as the Kussmaul breathing. Kussmaul breathing is absent in the cardiac tamponade. Okay, lap fanning. I think everyone knows this is the what metabolic acidosis. There is a low sodium, high potassium. Okay, see, you will see there is an increase in water ester, that is water. It forms the ketone. It's a ketone bodies. It has the ketone in the urine, blood, even in the breath, which causing the water in the breath, which causes the sweety fruit smell. This is sweet fruity smell. There is a blood sugar more than 250. See, guys, how we are going to manage that. Suppose, see, first of all, you have to do all the ABG and you have to do the electrolyte test. See, first of all, you have to give high amount of hot fluid and a replacement with a 1 to 2 liters of NS and IV fluids. Then you have to add water, you have to add the insulin. Remember what is the dose is the 0.1 unit per kg per hour. Okay, remember the insulin. And also you have to add the potassium if there is a hypokalemia, and you have to add the bicarbonates. Bicarbonates, if there is a acidosis, will persist. How you are going to manage the manage the decay patient? Okay. Remember the next one, these are the types of the vasculitis. These are the types of the vasculitis. Vasculitis, first of all, where we are having the large vessel vasculitis, large vessel vasculitis. We are having the giant cell, having the giant cell arteritis and the Takayasu arteritis. Takayasu arteritis. Okay. From this, guys, we are going to learn only 2 or 3 topics. Okay, remaining you can just master. Okay, so the first one is, guys, the first one we are going to study about the giant cell arteritis. From the giant cell arteritis, also called as temporal arteritis. What is temporal arteritis? There is a inflammation of the temporal artery. See how it's going to be. See, it's going to this. This is the case. A 70-year-old woman complains of throbbing unilateral headache with water vision problem. She report weight loss and the mandibular pain while eating. The patient also has the history of recurrent bouts of fever accompanied by malaise and the muscle. Okay, muscle. Physical examination reveals there is not the enlargement of the temporal artery. Not the enlargement of the temporal artery. Okay, na? So guys, this is the case of the giant cell arteritis. There is a giant cell arteritis. Okay, na? So let's remember, this is the most. That is the most common. It is the headache. If they are the most common specific, it is the jaw claudication, and the dangerous is the loss of vision. Then the loss of vision. These are the characteristics of what it is the giant cell arteritis, also called as temporal arteritis. What the treatment is if it is the steroids. Okay, na? Okay, na? So this is the from this. Okay, next, guys, from this one, medium and a small, we have to learn about these two one, the Kawasaki and the HSP. Okay, HSP. These are two important, and another one you can just study by heart, that one. Okay, we are going to talk about the Kawasaki and the HSP. These two are very important. So I will just follow this one. See, Kawasaki disease is what this is a medium vessel vasculitis, and the HSP is a small vessel vasculitis. See here in the Kawasaki disease, it will be seen in the most commonly seen in the less than 5 years of old. 5 years of old child, and fever will not here. Fever will not be decreased even after 5 days, and these are not decreased on antibiotics also. Okay, so remember here that we have the cream with the mnemonic. See, for the conjunctivitis, what these are the non-executive bilateral. Okay, na? We have the rash, that is the polymorphous rash. Edema, there is a adenopathy. There is a cervical adenopathy, and there is a mucosal involvement. That's showing the strawberry tongue. And there is a fissure leaves. So if you see any of these in the question, just mark diagnosis as the Kawasaki disease. Remember here what the treatment you are giving the IVIG. IVIG you are going to give in the high, and also you are giving the aspirin, that is the high dose, up to 80 to 90 mkd every 6 hours. So, okay, guys, see here, actually aspirin is not given in the children's, but in Kawasaki we are going to give the aspirin, because aspirin is going to cause the it is called the Reis syndrome. Remember here in the Hennes-Solen purpura HSP, this is the small vessel vasculitis. It is also called as Ajay vasculitis. Most commonly children's also. Sira in the HSP, guys. Remember there is a associated with the watermark. There is a purpuric. Remember the par mnemonic. There is a purpuric rash. The purpuric rash at the lower rim, especially at the buttock. There is a purpuric rash. There is a abdominal pain at the colicky. What is the matter is colicky pain. There is a arthralgia, joint pain. There is also a renal involvement. That is the nephritis. See, these are the points about the HSP. You have to remember PAR. Okay. So what is the treatment? Is the self-limiting. When there is one question in the NEET PG is that when to start the steroids. when if there is a if it is severe, if it is involved GIT. If severe and there is a GIT involvement, then you have to give the prednisone. That is the oral prednisone. Okay. Remember here that this is from the smaller, this is vagus, with the vagus granulomatosis. Remember, this is the upper respiratory tract and the kidney, lower. If these two are going to, if these two are going to affect, with there is a also strawberry gums. This is the vagus. Remember, this is the C. Remember, this is vagus. Vagus, vagus C. C means what? C anka body C. C anka body C in the vagus C. That's why C. C anka vagus C. Vagus C. Vagus C means what? C anka body C in the vagus disease. Okay. Treatment will be the what? This is cyclophosphamide. That's it from the vasculitis. You have to remember. See here, guys. Remember from the from the types of watermark, types of we are having the types of necrosis. Here we have to master this one. Master this, guys. We have to master the examples. Examples are very important. Suppose example here. Here this is the case. This is the case, guys. A 61-year-old female patient suffered from the stroke. So, guys, stroke means what? You have to think about the brain. Think about the brain, okay? Patient is an illness, and the fifth observation is that fall necrosis. See, they're not going to give directly in the brain like this. They're going to use some difficult diagnosis. That's why you have to know the everything. See, so from the stroke watermark, it means they're asking about the brain. It means watermark in the brain that there is going to be watermark. There is a liquefactive or collicutive necrosis. Remember remember here, but it is coagulative the parent necrosis. The example is HLK, coagulative HLK, heart, kidney, liver. Coagulative necrosis will never involve the brain. From the cases or cheesy likes, it is necrosis. It involves the TB, seen the TB and histoplasmosis and the sarcoidosis. Coming to the here the liquefactive and the collicate necrosis. There is a BAP. There is a liquefactive or collicate. There is a BAP. Example, BAP means brain, abscess, pancreas, whatever the parenchyma of the pancreas. Remember in the fibrin, this is the fibrin necrosis. The fibrin necrosis example is the SLE, rheumatic fever, PAN, and the malignant hypertension. Remember that it's a fat necrosis, BOP. It's a BOP of fat. BOP of fat. Like this is the BOP means breast, omentum, and there is a peripancreatic tissue. Okay. Here the only peripancreatic tissue here, the parenchyma is involved here. Remember here the gangrenous necrosis, and the wet and dry. But the example is the guys, diabetes mellitus, Burgess disease, mucormycosis, and the frostbite. Examples of the gangrenous necrosis. Remember here, guys. Remember we are having the two tests for the semen. Two tests for the semen. We are having the Barber's test. We are having the Barber's test and the fluorescent test. Okay. These two are for the semen test. We are in the Barber's test and the fluorescent test. Remember from the Barber's test. This is what it appears so yellow. You see the Barber's barber will what? Will shave the beard with using what? If you use the blade, needle. That's why it is the barber is with needle. That's why needle say that is a Barberia test. Remember here the fluorescent test. It is for the also for the semen. For the semen, we are having the two tests, fluorescent test and the Barberia test. In the fluorescent test, you see these are the choline iodide, guys. These appears at the dark brown rhombic crystals. Welcome to the guys. These are these two for the semen test, these two for the blood stain. These two for the blood stain, we are having the Takayama, crystals, and the Teichmann crystal. Takayama crystals and the Teichmann crystal. Takayama for the what is a pinky. Takayama pinky. So Takayama is the pinky feathery, and when this is the Teichmann crystal will be what color? Yeah, the brown crystal. Don't confuse with the fluorescent test. Okay. Fluorescent is for a semen. Remember for the precipitating test. Okay, now for the precipitating test, it is done for the water mark to identify the species identification. Suppose there is a two bones, you have to identify this bone whether this bone is for like human or animal. So you have to identify this one. That is the specificity test. Remember here, a 25-year-old lady comes to the clinic after 3 days of unprotected coitus. Suppose example, a two couples had sex and the girl came within the seven. And the girl came to me. I'm a doctor. Came to me within the 72 hours. Within the 72 hours, and she told that doc, we had this one, and I don't want to continue this one. Please do something. Okay, na? So guys, for this one, to avoid the fertilization, guys, first of all, I was so if the girl will come, within 72 hours, guys, then I will give the LNG, tanogestrol. How much amma? It is the 1.5 milligram single dose. Okay, done. If the girl will come within the 72 to 120, 72 to 120 hours, or at the fourth or fifth day, then I will do the what am I will do the I will insert the IUCD, or else I just use a pill, that is the ulipristal 30 mg. Pistol what am I 30 mg, that is the serotonin progesterone receptor moderators. Okay, so these are the two of them. Okay, either way I can give the IUCD or I can give the ulipristal 30 mg. So guys, if she came within the Vatama ninth week, within the ninth week, at the ninth week, then what I have to do, I will go with the MTP, that is the MTP, the medical method. This is the medical method. Okay, na? It is done for us 365, done for only for the first 63 days, or ninth week. Okay, ninth week only. Until ninth week only, we will do the MTP medical method. Okay, see here what we are going to do in the medical methods. First of all, you are going to give the MEPI. Now what we are going to give the MEPI. See, MEPI F means first what will give. First we are going to give the MEPI. How much? 200 milligram oral. Then after 8 hours, after 2 days gap, we are going to give the water misoprostol. How much? 800 mcg. Okay, then obviously all the content will be exported. First of all, first is the mifepristone. How much? 200. Then we'll go after 48 we'll do the misoprostol. Okay. See, if the pregnancy is if the pregnancy more than 10 weeks, then we will do the manual vacuum aspiration up to 12 weeks by using by using Carmen's cannula. So see, the number of AOG is equal to the size of the cannula. Suppose example, a patient a patient 12 weeks. 12 weeks of AOG, she came, and we are going to do the vacuum aspiration. They will ask you what is the size of the cannula. Then it told only, see, how many weeks is equal to how many what size of the cannula. For the second trimester, you have to do the mini labor. Okay, done. Next we come here for the mentally ill patient who will give the permission to the abortion. For abortion, see, husband has no role. Husband is only for the for only take care and the doing the pregnancy. Okay, see, only the guardian is the main important. See, this is the MTP Act. See, the 2021. See, guys, up to 20. See here, up to 20 weeks. Up to 20 weeks, guys, there is a one doctor opinion is required. That's listen for the contraceptive failures, for the contraceptive pregnancy due to contraceptive failure. For this abortion, guys, we will do until the 20 weeks only. We will do until the 20 weeks only. Pregnancy due to contraceptive failure, we will do the abortion at what at only 20 weeks only. See, between 20 to 20 weeks, guys, two doctor opinion is required. We will do we will do abortion for this if the patient is a minor, mentally ill, physical disability, pregnancy due to rape, sexual assault, incest, means whatever there is a familiar rape, and there is a change in the marital status and the disaster. We will do between the 20 to 24 weeks only. If the pregnancy automatically is more than 24 weeks, then we have to take the permission from the medical board. Okay. Okay, if there is any risk to the fetus, or if there is any risk to the fetus or genetic anomaly, guys, and also if there is any risk to the fetus or the mother, we can do the abortion at any time. Okay, See guys, next one is see guys. Next one is the see here. Next one is the guys. This is the biochemistry. We are having the series of diseases here. First of all is the alkaptosis. Is the this is what alkaptonuria. Alka means what kala. Ka means kala. Kala means a black. There is a black urine. What there is a black urine. See urine will turn black on prolonged exposure to air. There is a uchronosis. There is a uchronosis. What is the bluish black connective tissue, ear cartilage, and the sclera, and may have the debilitating arthralgias. Okay, what the enzyme deficiency? It is the homogentisate oxidase. I think everyone knows about this one. Next one is the albinism gas. Albinism gas, there is a pale skin, hairy is what very light and blonde. Albinism, it is the what tyrosinase is the deficiency. PKU, phenylketonuria, there is an intellectual disability, microcephaly, seizures, hyperpigmented skin, eczema, there is there is a musty body odor. Okay. What enzyme deficiency? It is the phenylalanine hydroxylase. Just remember the disease, characteristic, and the enzyme. Maple syrup disease, this is the DC, BC, KD, branched chain ketoacidosis, keto acid, dehydrogenase. This is water maple syrup, sugar. Syrup is sugar. Example, just remember, syrup is sugar is burnt sugar in urine. What I mean is that I love you. I love V. I love V means what? I for isolation, L for leucine, V for valine. For Lewis-Nihan syndrome, there is a self-mutilation. Self-mutilation. This is the picking one's skin here. Self-mutilation. There is also increase in the uric acid. The enzyme is the what HPR. There is a hypoxanthine guanine phosphorybolase transferase. Okay. Next one, guys. See the next one, guys. See we have in the stream here. There is a Unnati Jyoti by affordable leads for all. First one is the was Ujala. What Ujala anti means what? Velturu. Ujala ho gaya. It means Ujala this is lightning. So what Ujala means what? Ujala means what? The distribution of all distribution of LED leads. LED lights. Next see here there is a Ujjwala. What? Ujjwala. See, Ujala means what? There is a lightning. Ujjwala means what? Ujjwala means what? There is a free LPG connection. Is what? There is a free LPG connection. There is a free connection. Free LPG connection. This is a Ujjwala. See, Ujala, Ujjwala, Ujjwala. This is for what? There is a prevention of trafficking and the rescue. Okay, now? Okay. Then we have to remember this one. Next, remember this one for the Nikshay. We are having this is Nikshay program. Nikshay program for the for the TB, for the TB control, this is the TB control program. Actually, the incentive previously it is 500, but now it is increased to how much? Increases to 1,000 rupees. Okay, na? And remember here that this is the Nikshay. This is Nikshay. This is the Nikshay. Nikshay for what? Nikshay for that is the pregnancy kit. Remember this, there is a Nikust. Nikust is for what? This is for the system for the leprosy patient. Okay. Remember for the leprosy, guys, we are going to manage the leprosy. We have in the POSI, if the 2 to 5 skin lesions, we have POSI bacillary, we have the multi-bacillary, okay, POSI bacillary and the multi-bacillary leprosy. Remember the treatment. Okay, last time they give the one example. Suppose for the POSI bacillary leprosy, how much is the dose of the rifampicin? They ask the 600 milligram. Dapsone is the 100 milligram. In the multi-bacillary, we are going to add we are going to add the clofazimine. Clofazimine water, how much is it? 300 mg. Okay. Next is the guys. This is the Lakshya program. This is Lakshya program providing the quality. Q for what? Quality room. Lakshya quality. Q for quality. Alpha level room. Okay, for quality room. Remember here the Nikshay TB Nikshay for the Nikshay for the pregnancy kit, Nikust for the leprosy, Lakshya for the providing quality room. Remember here, we are having the national program for the control of blindness and visual impairment here. Remember, suppose example they ask you what is the definition of the blindness? It is the vision is less than 3/60 in the best eye with the possible correction. Okay, now. What is the most common cause of blindness? It is the cataract. Then it is followed by the refractive errors. Remember here, this is the definition. Remember here, this is what they're going to ask in the exam. What is the social manifest low vision economical? Okay, now see here, the mnemonic is the guys. The mnemonic is the lesma, not lesbian. It is the lesma. L for low vision, E for economic vision, S for social blindness, M for manifest blindness, A for what, amma? Absolute blindness. Okay. What is absolute means? Completely there is no perception of light. Is the absolute blindness. Don't worry. This is they will not going to ask you this one. Okay, na? Remember, social blindness, what, amma? Social blindness means there is a less than 3/60. Okay. So remember this. Low vision, what means what, amma? There is less than 6/16 in the better eye. Okay. 6/16 to 6/60 in the better eye. Economical blindness is the 6/60 into up to less than 3/60, 660, that is 6/60 in a better eye. Social blindness are that is the less than 3/60 up to 1/60 in the better eye, and manifest blindness is the 1 by less than 1/160. This is what they are going to give these values in the examination. Okay, na? Please at least remember these first values. Okay, remember these first values. This is what they're going to give in the examination. Okay, now you have to identify whether this is the social or a low vision or a economical blindness. Okay, done for this one. So thank you very much, guys. If you have any more doubt, please try to share with me. Okay, now thank you very much, guys. Please try to subscribe also. Thank you very much.